Today on Let's Talk Wellness Now, we're diving into the most cutting edge and misunderstood frontiers in chronic illness treatment. Induced native phage therapy, or INPT, and induced native microbial therapy, INMT. My guest is Dr. David Jernigan, one of the country's most innovative minds in biologic and bioregulatory medicine. Dr. Jernigan is widely known for his pioneering work in the treatment resistant Lyme disease and chronic infections, and for pushing the boundaries of what's possible when we stop fighting the body and instead learn how to regulate it. He is the inventor of multiple advanced diagnostic and therapeutic technologies, including biospectral emission sequencing, matrix interface testing, chronoquantum testing, and most recently, INPT and INMT, technologies that aim to activate the body's own native intelligence to restore balance and eliminate chronic infection. Dr. Jernigan is the author of 5 books, including the best-selling Beating Lyme Disease, and trained extensively in Europe, biologic medicine, and under Thomas Rau at the Paracelsus Clinic in Switzerland. His work challenges the conventional infectious disease model and raises an important question. What if chronic illness persists, not because we haven't killed enough pathogens, but because we haven't restored regulation? This is going to be a fascinating and paradigm shifting conversation. But before we dive in, let me remind you, this podcast is about empowering you with knowledge to make the best choices for your health. So grab your tea or coffee and let's talk wellness now. So for those of you who have heard me before, you're going to recognize my voice is a little froggy today. I've been fighting a little laryngitis for the past couple of weeks, so forgive me for my voice sounding a little bit off. You may see me drink a little bit on this episode just to kind of moisten my voice. I am totally fine. I'm not sick. I am just fighting this laryngitis that just will not go away. So it is clearly telling me something, but I'm going to keep pushing forward, bringing you amazing guests like Dr. Jernigan today. And I am so excited for this conversation. For those of you who know me, I've been treating Lyme for 20 years. So this is going to be an amazing conversation for me as well as you. And we are going to learn some great things together. Right after we get back from our sponsor, we are going to bring Dr. Jernigan on and we are going to have this amazing conversation. Did you know sweating can literally heal your cells? Infrared saunas don't just relax you, they detox your body, balance hormones, and boost mitochondrial energy. I'm obsessed with my Health Tech sauna. And right now, you can save $500 with my code at healthtech-health.com/dr-muth-req-25.
Hello.
Hi there. Sorry for all the confusion.
Oh, no worries. You gotta love it, right? How are you today?
I am good, thank you. How about yourself?
I'm good. Well, it's good to finally meet you and get this thing rolling.
Yes, yes, I'm so sorry about that.
That's all right. So tell me about yourself before we get going.
Yeah, so I am a nurse practitioner. I'm also a naturopath.
Hmm.
I have a practice here in Wisconsin. I've been treating Lyme for about 20 years. So I'm
Okay.
really excited to have this conversation and learn what you're doing because it's so exciting and new.
Well, thank you.
So we treat a lot of chronic illness patients, do some anti-aging regenerative things as well. So
Yeah, I went to your website and saw you guys are killing it, looks like. Got a lot of good staff, it looks like.
yeah, we've got great staff, great patients, busy practice. We have 5 practitioners. So we have about 15,000 patients in our practice right now.
Well, excellent. I'm excited for this discussion.
Good, me too. So I pre-recorded our intro so we can just kind of dive right in and I'll just ask you to kind of introduce yourself a little bit, tell us a little bit about yourself, and then we can just dive right into it.
All right.
Okay.
I'm Dr. David Jernigan, and I own the Biologics Center for Optimum Health in Franklin, Tennessee. And I've been in practice for over 30 years. I shook Willy Bergdorfer's hand, if anybody knows who that is. Kind of infamous now with some of the revelations that have happened about Lyme being a bioweapon and weaponized.
Mhm.
But I've been doing this probably longer than almost anybody that's still in the business in the natural realm. It chose me. I did not choose Lyme. Matter of fact, there were many times in my career that I was like, cancer is easier because of the fact that everybody agrees what we're dealing with. And in the 90s, it was a whole different reality where nobody actually understood that you could have Lyme disease and not be coming from New England. So I had actually the first documented case of a Lyme disease, CDC positive patient that had never left the state of Kansas before. So they couldn't say that it wasn't in Kansas. And so she had actually been pregnant with twin boys, and they were born CDC positive as well. And so it is transmitted across the placenta, we know. So the history of how I did all this was in the 90s, probably 1996, probably somewhere in there, 97, with this woman. If you go into Robbins pathology books from back then, which we all used, medical doctors and everybody else studying, there was basically a paragraph about Lyme disease. And on the national board tests, as you recall, it was probably like, what causes or what is bullseye rash associated with? And you'd had to guess Lyme disease. But that was considered to be more a New England illness, and you would never see it anywhere else. But here was this woman. I knew nothing about Lyme beyond what we had gotten taught in college, which was, like I say, next to nothing. And she would not let me stop feeding me information. I mean, you got to remember the internet wasn't even hardly in existence in
Yeah.
those years. I mean, it was brand new. It was supposed to be this information highway. So I started purchasing, like a lot of doctors do even now. They start purchasing every kind of new supplement that's supposed to work for bacteria. There was no product in those days that actually was Lyme specific. I mean, nobody was really dealing with it naturally. It was always a pharmaceutical situation.
And a very short course at that.
Yeah, 2 weeks of doxy and you're cured, whether your symptoms are gone or not, which she'd had the 2 weeks of doxy and her symptoms and her son's symptoms were not gone. And so I absolutely just purchased everything I could find. Nothing would work. I mean, I could name names of products and you would recognize them because they're still out there today, which is a sad thing that natural medicine is still riding on these things that have the most marketing as to sometimes the things that actually have the documented research behind it. I am a doctor of chiropractic medicine, and I specialized all these years in chronic incurable illnesses of all types. That may sound odd to a lot of people, but doctors of chiropractic medicine are trained just like a GP typically would be. The medical schools, as I understand it, got together decades ago and said, wow, if all we did was crank out general practitioners for the next 10 years, we wouldn't have still enough general practitioners to supply the demand.
Right.
Everybody in medicine, in medical schools, wanted to be a specialist because that's where the money was. And it was
Mhm.
easier kind of also to, just focus on one part of the body and
Yep.
specialize in that.
Be an expert in that one area.
Yeah. So we all now have the same training. We all go through pre-med. We got a bachelor's degree. I got my bachelor's degree in nutrition and through Park University in Parkville, Missouri. When I ran out of options to purchase, I just used a technology that I developed, which was an advancement upon other technologies, but I called it bioresonance scanning. And I coined the term back in the 90s. It was a way to kind of like a sensitive test, like you might would think
Mhm.
of applied kinesiology, then clinical kinesiology, then chiro plus kinesiology, then, you can just keep going with all the advancements that were made. Well, this was an advancement upon those things. So I was the first in my known world of doctors to develop a way to detect adjunctively, obviously we can't say it's a primary diagnosis, adjunctively detect the presence of a given specimen. So we could say, thus saith my test, it's highly likely you have Borrelia burgdorferi. But I had to have the specimen on hand to be able to match what I call frequency matching to the specimen, brand new concept in those days. And so I was able to detect whether or not my treatments were successful or not. This is something even now that's really difficult for doctors because antibody tests, even the most advanced ones, it's still an antibody test. It's still an
Right.
immune response to an infection. And accurately, some doctors will slam those tests saying, well, that doesn't mean you actually have the infection. That just means your body has seen it before. which is a
Mhm.
correct statement, kind of. So being able to detect the presence and even where in the body these infections are was a way huge advancement in the 90s for sure. It's kind of funny. I think about a conference I went to, and I'm kind of jumping ahead because I ended up developing my own formula just for this woman and her children, and it worked. And I was like, wow. Their symptoms were gone. All the blood tests came back negative. In those days, we were using the IGeneX Western
Mhm.
blot eventually, and the what was called a Lyme urine antigen test. I don't know if you remember that because it only decades later did I meet the owner of IGeneX, Nick Harris, in
Mhm.
person. I was like, whatever happened to the Luat test? Because they took it off the market after a while. He said,
Yeah.
honestly, we lost the antigen and couldn't find it again.
Oh
And
no.
so, but that was a brilliant test. It was the actual gold standard in those days. Again, the world, it can't be understated how different the world was in the 90s towards natural medicine, even.
Oh yeah. Like
Um,
we think it's bad now, but like when I started too, I started in the early 2000s. Like we were all hiding under the radar. Like you didn't market. We would have never been on social media. We didn't run ads. We didn't do any of it
right.
because the medical boards were coming for us with
They
what
came after me, had the word Lyme on my page, my website. Not saying that I treat Lyme,
just
just
talking
something.
about Lyme. Hmm.
And it's funny because once I had this formula, it was something, and I trained in Germany in anthroposophical medicine, and
Hmm.
they've been trained in making herbal extracts, making homeopathic remedies in the anthroposophical methodology. And I trained with the Hahnemann versions of homeopathy, which is just slightly different.
Yep.
And so I was well versed with making some own formulas by that time. It was really something that I wrote on the bottle, and I had to call it something. So I called it Borrelogen, which is still in existence and it's still a phenomenal herbal remedy right now. And to my knowledge, it's the only frequency matched herbal formula maybe still out there. Because unless you knew how to do my testing,
Mhm.
the bioresonance scanning, there was no way to actually do frequency matching. Matter of fact, a really famous herbalist attacked me online saying, "Oh, none of these herbs will kill anything." And I'm like, that wasn't what I was saying. I was saying back in those days, I was saying, well, if what would the body need to address these infections, not
Mhm.
like what's going to kill the infections for the body.
Right.
Right. So it was a phenomenal way. But the LUAT test was amazing because what you do is you would give your treatment, like an MD would give an antibiotic a week ahead of time, trying to increase the number of dead spirochetes showing up in your urine one
Yeah.
day out of the 3 days urine catch. So you'd wake up in the morning, you'd collect your urine 3 days in a row, and any one of those being positive is a positive. But it was a brilliant test because it wasn't an antibody test. They were literally counting the number of dead pieces of Lyme bacteria in your urine. I mean, it was pretty irrefutable. So I had a grand slam on the Western blot on patients, and I'd also have a grand slam on the LUAT, and their medical doctors would say, "Oh, that doctor in the lab are probably in cahoots. Change some lab." The
Of
values
course,
that come
right?
in. And I still see that today. It's like, oh my gosh, the better the tests are getting, there's still a bias if you do your own research. Well, if you
Yeah.
happen to be a doctor who loves research and you're a clinician, so you actually treat patients, who's going to write the research study? Well, of course, the doctor who did the study, well, he's biased. And I'm like, I still can't influence lab tests. Well, lab tests aren't everything. People scream over the internet at me. I was like, well, no, a negative lab test doesn't mean anything. I was like, I get that with the old Western blot testing, but
Right.
the more sensitive tests, which are very close to 100% sensitivity and
Mhm.
100% specificity. So meaning like they can, if you have the infection, they're going to find it. And if you have the infection, they're going to be able to tell you exactly 100% correctly what kind of infection it is. Back in those days, you couldn't. You could just count the dead pieces, which was
Yeah.
significant. But it's funny because when medicine does that, mainstream medicine that's backed by all the nice foundations who donate millions of dollars towards the research, their negative tests are significant. But if you fund your own, yours isn't that significant.
Right. Or what if we call something a seronegative autoimmune disease like lupus or rheumatoid arthritis? Because none of the tests are positive, but you have all the symptoms. Here,
Hmm.
let me give you this $100,000 a year drug.
Yeah.
And instead of looking for what might actually be causing the symptoms, that's all okay. But what we do is not okay.
Right. Yeah, it's a double standard and it's
Yes,
getting better. I want to do tell the world it is getting
it
better.
is.
Some of the dinosaurs are retiring and
Hmm.
making way for people who are more open-minded to new ideas. But getting back to that woman, that formula that I made just for her and her son, she went online, which I had never been on a news group.
Hmm.
I'm not even sure I knew what one was. I mean,
Yeah.
imagine I'm kind of that dinosaur that cell phones were like these really big things with a big antenna sticking out of it. And so I thought I was pretty hot stuff, just that I actually had a computer software program that was running my front desk. And even then, it was an Apple IIe computer.
Right.
Probably be pretty valuable right now if I'd kept it, but
Hmm.
just being an antique. Suddenly, people were calling my clinic because the lady with the twin boys that was well was telling people on these Lyme disease forums and boards online. I started going, oh my gosh, as a doctor, it's one thing to treat a person in your clinic, it's a different thing to have your clinic name on the label, like we all do sometimes
Yes.
even now, and you're supposed to write everything that's on the label and
Hmm.
all these guidelines, and I'm like, wow, I need to split this off. I mean, I definitely want to help people, and I was pretty excited about the results we were getting pre-treatment and post-treatment, and so that's where I developed my nutraceutical business in the 90s called Jernigan Nutraceuticals. My advice to anybody thinking about doing the same thing, don't put your last name on it.
Mm-mm.
Because anytime negative anything comes out, there goes the Jernigan name, because
Yep.
the herbal, there's just all these, and especially nowadays with all the bots that are just designed to slam natural medicine.
Yeah.
And that is out there and just ugly people. Should we just say people with a different opinion? How's that?
Yeah.
That are being less than supportive. But
Hmm.
it was amazing because by 1999, I presented my research, my first research. I'd never done research.
Hmm.
This is what I would say to a lot of people who go, my doctor did. I don't know. My doctor doesn't know what you're doing. I was like going, most doctors don't do research. They don't publish anything. Their
Hmm.
opinion is their opinion, but they don't back it up in peer review, right? And so that's what I
Right.
always tried to do is back it up in peer review and publish. And so in 1999, I presented at the International Tick-Borne Diseases Conference in New York City. I'm telling you, it was like the country boy going to the city. I got my suit on and I looked
Hmm.
all right and my booth was wonderful and all these different things and it was just a big wake up call because what we had demonstrated, let's get back to and this was what I demonstrated with that first study. A positive LUAT test, that Lyme urine antigen test from IGeneX, was a score of 32, meaning one of those 3 mornings urine had 32 pieces in the amount of urine they checked of dead Lyme bacteria spirochetes. Okay.
Okay.
With antibiotic challenges, a highly positive was a score of 45. When I would give one dropper 3 times a day for a week ahead of time and then do the person's LUAT test, we were getting scores 100, 200. And at that point, we only had a couple, but we had a couple that were greater than 400 dead pieces where the lab just quits counting. They just said,
Yeah.
somewhere over 400, right?
Yeah.
Which, when the medical system at the conference, I was the only natural doctor in the world that had any
Mhm.
kind of proof of anything naturally that could outperform antibiotics. Can you imagine?
Yeah.
And they were just, oh my gosh, incredulous. They're like, I've given the most. One guy came up to me and to my face and he goes, I've given the most aggressive antibiotic protocols and I've only seen one patient over 100. I was like, that makes this pretty significant, doesn't it? It didn't just like make us take off because guess what? In Lyme world, if a pharmaceutical antibiotic made you feel horrible, that meant it was working.
That's right. We used to back in the day, if you didn't
Mhm.
herx and have that horrible
Yep.
die-off reaction, for those of you who don't know what a herx is, but if we didn't make you herx, we weren't doing our job right.
You're looking for your patients to feel horrible and sometimes to the level of committing suicide. Their symptoms get
Yes.
so bad. And I was the first doctor, I think, in the world to start screaming and hollering and saying, stop using the worsening of your patient symptoms as a guide to good treatment. I wasn't seeing it with my formulas because I was doing a comprehensive program of care. I think I was also one of the first doctors to say, we need to detoxify these people as we're doing this. And you would sit there and say, well, sure you were. I was like, well, remember, there wasn't a lot of communication. There wasn't anybody on the internet saying, do this, do that. It was interesting in those days. It was how do you help the world heal from these things they don't know they have? So later, I actually had a beautiful booth at a big health expo in Texas, I remember, and I was like, you spend a lot of money on the booth,
Yeah.
and you're thinking about it because you're funding the whole thing. You say, wow, if I only sell one case, I'll at least cover my cost.
Yeah, you're
And I
grateful.
had this beautiful banner of like a blown up tick's mouth under microscope. Those beautiful pictures of like all the
Yeah.
barbs sticking out and how they anchor themselves in your skin, and
Hmm.
1,000 people walking by my booth, and they just like keep walking because they didn't know they had Lyme. There was like, and they had MS maybe, but they don't have Lyme. And so they just would keep walking. Nobody even knew. Why would I go to a conference in Texas? And I'm trying to say, no, guys, it's everywhere. And everybody, yes, you probably have this. Kind of thing. If you are chronically ill almost of any kind of way, kind of trying to tell people this was again in Robin's pathology textbooks. One of the few things that it did tell you about Lyme was that it was called the new great imitator
Hmm.
because it would imitate up to 200 or more different illnesses. So it's been an interesting journey, educating people, writing articles. But it was interesting. The lady who I first fixed, laboratory verified, everything like that, symptoms went away, all that kind of fun stuff. Her children were fine. They've been fine for years now. When she went on the news boards and the Lyme disease support groups, created a war. Oh my goodness. It was like, how dare you say that something natural might actually help, right?
Right, exactly.
And I even had one of those first calls to with a marketing company at one point, way a long time ago. And the lady got on the phone. The owner of the marketing company goes, I would have blood on my hands if I actually took your clinic on. Yeah, you can't treat Lyme disease. And even the big, big associations that are out there are still largely that way. I mean, they're getting better, but it's just like, a lot of the times it's herbs are good. Herbs will help. Herbs
Hmm.
are good, but they're safe. So it's still a challenge to present in mainstream Lyme communities, even because there's this fear of doing anything outside of antibiotics.
So let me ask you this, from your perspective, why do you think so many chronic infections exist these days, like Lyme and the co-infections, Babesia, Bartonella, mold illness? And we talked a little bit about herbs and why antibiotics and things like that fail, but let's talk a little bit about that.
So it's fascinating. When I trained in Germany, they said that we as humanity has moved away from what they called the inflammatory diseases. In the old days, it was
Mhm.
lots of high fevers, purulent pus generating bacterial infections.
Mhm.
And they said, as a society, we have shifted from those to what they call cold sclerotic diseases, which are your cancers, your diabetes, your atherosclerosis. And they said we're starting to see what used to only be geriatric diseases in our children. That's how bad it's gotten.
Yeah.
We have suppressed fevers. We don't respect the wisdom of the human body. So,
Mhm.
the doctors say, step aside, body. I will fix this infection for you with this antibiotic. And so, what we've done with the overuse of antibiotics, and this isn't me just talking from a natural perspective, this is
Right. It's
everybody
well
around the world
documented.
is acknowledging. And
Mhm.
I'll show you, I could show you a presentation if we can do a screen sharing situation
Yeah.
about the antibiotic situation in the world, because it's really concerning. But what I would say, and kind of like an advance forward, is we are seeing mutated bacteria. They talked about, do you remember when they found the Iceman,
Yeah.
the prehistoric guy that's in the ice
Thousands
and he had
ago.
Lyme bacteria? I was like, he had spirochetes, maybe. That isn't a modified, mutated version. That's just maybe the Lyme,
Mhm.
Borrelia, call it Borrelia something. it's a spirochete. But what
Mhm.
we're dealing with today, even under strep or staph, as
Yeah.
Pseudomonas aeruginosa, you name it, whatever the kind of infection a person has, is not the same bacteria that your grandparents dealt with.
That's right.
It's a much mutated, stronger, more resistant to treatment type of thing.
Mhm.
So I think that's one reason. I think it's great that we're seeing Secretary Robert F. Kennedy Jr. bringing awareness to things that, like it or not, yeah, seed oils do create inflammation, and everyone in the natural realm, as you know, has been trying to say this for probably how long?
Yeah, 25, 30 years, 20 years at
Yes,
least. Yeah.
yes. Thank goodness for people like Sally Fallon and her beautiful book, Nourishing Traditions, that started,
Mm.
Dr. Bernard Jensen's books way back in the day, Dr. Christopher's books way back in the day.
Yeah.
All of them were way ahead of their time saying,
Mhm.
by the way, your margarine is only missing one ingredient from being axle grease.
Yeah.
I think that was Dr. Jensen saying that at one point, probably 50, 60 years ago. I don't know.
Yeah.
So we've created this monster. We live in a very controlled environment, of 72, 74 degrees at all
Mhm.
times. We don't sweat. We don't have to work that hard typically. Most of us aren't out there like our ancestors were. So that's making us more and more move towards the cold sclerotic diseases, of which even Lyme disease is. Yes, it has inflammation. Yes, but it as a presentation, very often associated with some of these cold sclerotic diseases of mankind that we see now.
So tell me, what is phage therapy?
Well, may I show you a cool video?
Yeah, I'd love
I did
that.
not make this video. This is just one of my favorites because it's from the National Institute of Health. Let's see if I can just click the share screen thing. That's not what I'm looking for, but it's going to be soon. Let's go here. All right, can you see that?
Yeah. Yes.
Okay.
Modern medicine faces a serious problem. Thanks in part to overuse and misuse of antibiotics, many bacteria are gaining resistance to our most common cures. Researchers are probing possible alternatives to antibiotics, including phages.
So bacteriophages, or we like to call them phages for short, are naturally occurring viruses that infect and kill bacteria. The basic structure consists of a head, a sheath, and tail fibers. The tail fibers are what mediate attachment to the bacterial cell. The DNA stored in the head will then travel down the sheath and be injected inside the cell. Once inside the cell, the phage will hijack the cellular machinery to make many copies of itself. Lastly, the newly assembled phages burst forth from the bacterium, which resets their phage life cycle and kills the bacterium in the process.
Someday, healthcare providers may be able to treat MRSA and other stubborn bacterial infections using a mixture of phages, or a phage cocktail.
Process would be first to identify what the pathogen is that's causing the infection. So the bacterium is isolated and is characterized. And then there's a need to select phage in a process known as screening of phage that are either present in a repository or in a so-called phage library that allows for many of the phages to be evaluated for effectiveness against that isolated bacterium.
Phages were first discovered over 100 years ago by a French Canadian named Félix Derel. They initially gained popularity in Eastern Europe. However, Western countries largely abandoned phages in favor of antibiotics, which were better understood and easier to produce in large quantities. Now, with bacteria like these gaining resistance to antibiotics, phage research is gaining momentum in the United States once again. NIAID recently partnered with other government agencies to host a phage workshop where researchers from NIH, FDA, the commercial sector, and academia gathered to discuss recent progress. NIAID
So that is what phage therapy is in what I call conventional phage. Let's see, how do I get out of the share screen? Oh, here we go. See it.
Yeah, at the top, there should just be a
There we
box.
go.
Stop sharing. Yeah.
So conventional phage therapy, as you just saw, is a lot like what it is that we're doing, only the difference is they're taking wild phages from the environment. They're finding phages anywhere there's like a lot of bacteria.
Mhm.
And then they isolate those phages. And like he said, the gentleman at the very end said we put them in a library. And so there are banks of phages that they can actually now use. And one of the largest banks that I know of has about 700 different bacteriophages or phages in their bank that they can pull from.
Wow.
You want to take a guess how many bacteriophages they've identified are in the human gut on average?
Oh my God, there's got to be millions.
Different kinds of phages. How many?
There's got to be millions.
Well, in population, there's humongous numbers. Numbers probably well beyond the trillions, okay? Hundreds of trillions, quadrillions maybe even. But in the gut, a recent peer-reviewed journal article said that there were 32,242 different types of bacteriophages that live naturally in your intestines, your gut. 32,000. Okay, so if you read any article on phage therapy that's in peer review, almost every single one in the very first paragraph, they use the same sentence. They go, phages are ubiquitous in nature. They're ubiquitous in nature. So my brain, when all this finally clicked together, and it only clicked together 5 years into my research, I could not get it to work. 5 years. I just kept going. But that sentence really got me going. I was like, if you look at what ubiquitous means, it says if phages were the size of grains of sand, like sand on the beach, they would completely cover the earth and be 50 miles deep. How crazy is that?
Wow.
That's how many phages there are on the planet. There's so many, they outnumber every species collectively on the planet. So it's an impossibility in my mind. I went, it's an impossibility that you catching a sterile bacteria, it's almost an impossibility. Since the beginning of time, phages have been needing to use a reproductive host. It's very specific. So every kind of bacteria has its own kind of phage it uses as a reproductive host. Because phages are, and this is a clarification I want to make for people, just like in the old days, we were talking about the 90s. I talked to a veterinarian that had gotten in trouble with the veterinary board in her state back in the old days because she gave dogs probiotics. And the board thought she was giving the dogs an infection so that she could treat them and make money off of the subsequent infection.
Oh my God.
Nobody actually had heard of good, friendly bacteria in the veterinary world, I guess. But she said she had gotten in trouble and she had to defend herself that, no, I'm giving friendly, benevolent, beneficial bacteria, to these animals and getting good results. So phages are friendly, benevolent, beneficial viruses that live in your body, but they only will infect a certain type of bacteria. What that means is if you have Staph aureus, Staphylococcus aureus bacteria, that bacteria has its own kind of phage that infects it called a Staph aureus phage. E. coli has an E. coli phage. Each type of E. coli has its own phage. So Borrelia burgdorferi has its own Borrelia burgdorferi type of phage, whereas Borrelia miyamotoi, or any of the other Borrelia species, or the Bartonella species, you just keep going. Anaplasmosis has its own type of phage that only will infect that type of bacteria. So that's, when you realize, wow, why are we going to the environment, was my thought. Trying to find wild phages and put them into your body, and hopefully they go and do what you want them to do. What if we could trigger the phages themselves that live in your body to, instead of just farming that bacteria that it uses as a host? Because what I mean by farming is the phages will only kill 40% of that population of bacteria a day.
Wow.
And then they send out a signal to all the other phages saying, stop killing, because they want 60% of the bacteria population left to be breeding stock. It's kind of like the farmer, the rancher, who he doesn't send his whole herd to the butcher. He's just to, he keeps his breeding stock. He sends the rest, right? So the phages will kill 40% of the population every day just in their reproduction process. Because once there's so many, as you saw in the video, once the phage lands on top of the bacteria, injects its genetic material into the bacteria, that bacteria genetic engine starts cranking out up to 5,200 phages per bacteria. I don't know who counted all those inside of a bacteria, but some scientists peer-reviewed it and put it out there. That ruptures, and it literally looks like a grenade goes off inside of the bacteria. I wish I'd remembered to bring that video of a phage killing a bacteria, but it just goes poof, and it's just a cloud of dust. So you're breaking apart a lot of those different toxins and things. So that was the impetus to me creating what I did. That and the fact that I looked it up and I found out that phages will sometimes go crazy. I don't know how to say it. Wiping out 100% of their host. And it could be a trigger like change in
Mhm.
the body's pH levels. It could be electromagnetically done, like there's been documentation of, I think it was 50 hertz electricity triggering one kind of phage to go crazy and annihilate its host population. There's other ways, but I was like going, none of those fit me. It's not like I'm going to shock somebody with a jumper cable or something to try to get phages to do that kind of thing. But the fact that it could be done, they can be triggered, they can switch and suddenly go crazy against their population. But what happens when they kill 100% of their host? The phages themselves die within 4 days.
Because they can't keep reproducing
There's
because they,
nothing to reproduce them, yeah.
yeah.
Especially unless they're a polyvalent phage. That means a phage that can segue and use one or two other kinds of bacteria
Mhm.
as a reproductive host. But a lot of phages, if not the majority, are monovalent, which means they have one host that they like to use. And so Borrelia. So my study that I ended up doing, and I published the results in 2021, and it's a small study, but it's right in there at the high end, believe it or not, of phage research. Most phage research is less than 30 people,
Mhm.
in the study, but we did 26 people. And after 1 month of doing the phage induction that I invented, which only appears to only induce or stimulate the types of phages that will do the job in your body. I don't care what kind of phage it is. I don't care if it's a Borrelia phage. It may be a polyvalent phage that normally doesn't use the Borrelia burgdorferi as its number one host, but it can to go and kill that infection.
Mhm.
And the fascinating thing is, there was a brand new test that came out at the same time I came out with the idea. Literally the same weekend, they presented it at
Mhm.
the ILADS conference in Boston in 2019. It was called the Felix Borrelia phage test. So the Felix Borrelia phage test. Because Borrelia are often intracellular, right? They're buried down in the tissue.
Yeah.
They're not often in the blood that much. And therefore, doing a blood test isn't really that accurate.
Mhm.
But you remember how there's like potentially as many as 5,200 phages of that type erupt from each bacteria when it breaks apart? It's way easier to detect those phages because they're now circulating, those 52, as you saw in the video, 5,200 different phages are now seeking out another Borrelia that they can infect.
Yeah.
And so while they're out in circulation, that's easy to find in the bloodstream. So 77% of the people, so 20 out of 26 were tested after a 2 week period after only a 4 day round of treatment. Because according to my testing, remember, I can actually test
Yeah.
adjunctively to see if I can find any signatures for those kinds of bacteria. And I couldn't after 4 days. So we discontinued treatment and waited beyond the 4 days that would allow the phages themselves to die. So we waited about a week and a half
Mhm.
and redid the test. And 77%, so that 20 out of 26 of the people were completely negative,
Wow.
which you go, well, it's just a blood test. Well, no, we actually had people that were getting better, like they'd never gotten better before. We had one woman who was wheelchair bound and in 2 weeks was able to walk and even ultimately wanted to work for my clinic. I'm just like going, I didn't want to write about all that. I wanted to write about the phages. I was like, in
Yeah.
the article, I probably should have put some of those stories because critics would say, well, you got rid of the infection maybe, but did you fix the Lyme disease? Well, there's two factors here that every doctor needs to understand. There's the infection in chronic illness, there's the infection, and then there's the damage that's been done. Because
Yeah.
sometimes I have these people that would come in and say, well, Dr. Jernigan, it didn't work for me. I'm still in the wheelchair.
Mhm.
And I'm like, no, it worked. Repeat lab test over months says it's gone, it's gone, it's gone. It's like we would follow. And 88% of the people we followed long term were still negative, which is amazing to me.
And then they have to repair the damage.
It's the damage is why you still have your symptoms. And
Yeah,
that's where the doctor has to get busy, right?
right.
They were told erroneously by their doctor that originally treated them that they'd be well, they'd get out of the wheelchair if he could actually kill all these infections. Well, it's not
Mhm.
true unless it's caught early. So I
Yeah,
love the analogy, and I've said it 1,000 times, that Lyme disease and chronic infections are much like having termites in the wood of your house. If you find the termites early, then yeah, killing the infection, life goes back to normal. The storm comes and your house doesn't fall down. But if it's 20 years later, killing the termites is still a grand idea. But you
right.
but you have the damage in the wood that needs to be repaired as well. All the systems. When I talk about damage to the wood, I mean like all the bioregulatory aspects of the body, how it regulates itself, all the biochemical pathways, the metabolic pathways we all know about, getting the toxins that have been lodged in there for many years, stopping the inflammatory things that have been running crazy, um, dealing with all those cytokines that are just running rampant through the body, creating this whole MCAS situation, which are largely coming from your body's own immune cells called macrophages, which are not even, it's not a virus at all. It's part of the immune system. It's like a Pac-Man. And research shows that, especially in spirochetes, there is no toxin. Now, I wrote 4 books. I think I wrote the very first book on the natural treatment of people with Lyme disease back in the 90s. Why did I write that? Not because I wanted to be famous. It's a tiny book, actually. The first one was. I was just trying to help people get out of this idea that you will be well when you kill all the bugs. I was saying you need to be doing this. If you can't come to my clinic, at least do this.
Hmm.
Or try to find somebody that will do this for you. And that ultimately led to a bigger book as I kept learning more. And I was like, going, well, okay, now at least do this amount of stuff. And you need to make sure your doctor is handling this, 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 and this. And so the third book was like 500 and something pages long. And then the fourth book was 500 and something pages long. And now they're all obsolete with the whole phage thing because this just rewrites everything.
Yeah.
It's
Do you
pretty
think
fascinating.
do you think the war on bugs mentality created more chronic illness than it solved?
Because of the tools that doctors had to use, yes.
Yeah.
We're a minority. We're still a minority, you and I, and
Yep.
our doctoring um, methods. I never had, and you never, well, maybe you did, but I'd never had the ability to grab a prescription pad and write out a prescription. I had to figure out how do I get, and this was, and still my guiding thing is like, how do I identify, number one, everything that can be found that's
Mhm.
gone wrong in the human body, and what do I need to provide that body? Like the body is the carpenter that has to do the repair, has to regenerate, has to do everything, has to get everything fixed, right? We can't fix anything. If you have a paper cut, there isn't a doctor on the planet that can make that go away
Right.
of their own power, much less chronic illnesses. So all the treatments are like the screws, saws, hammers, you know,
Hmm.
the carpenter must be able to use. So a lot of the time, doctors are just throwing an entire Home Depot on top of the carpenter in the form of like bags of supplements, hundreds of supplements. I've seen patients walk in my door with 2 suitcase fulls, and they were taking 70 bottles, 65 to 70 bottles of supplements. And I'd be just like, wow, your carpenter who's been working for 24 hours a day, 7 days a week, he's exhausted. There's chaos everywhere. He doesn't know where to start. And
Hmm.
he goes, you want me to do what with all this stuff?
Yep. I've seen the
So,
same thing. And people, thousands, several $1,000s a month on supplements and not any
yeah,
better. But they're afraid to give up their supplements too because they don't want to go backwards either. And there's got to be a better way on both sides, the conventional side and the alternative side.
right.
Although you and I don't say it's alternative, that's the way medicine should be, but
Right.
we have to have a good balance on both sides.
And I will say too, in defense of doctors using a lot of supplements, I do use a lot of supplements.
Yeah,
Don't
I
get
do
me wrong,
too.
but I want to synergize what I'm giving the patient so that the carpenter isn't overwhelmed and can actually get the job done. Like everything has to work harmoniously together. So it's not the number of supplements. And why would you need a lot of supplements? Well, because every system in your body is messed up.
And
My kind
sometimes
of
we just have too
clientele
many
for 30
cooks in the
years,
kitchen.
our clientele, yours and mine,
Yeah,
they have been sick for decades, many of them. And if they went into a hospital, they honestly need every department. They need
mhm,
endocrinology, they need their kidney doctor, they need their cardiologist, they need a neurologist, they need a rheumatologist. I mean, because none of those doctors are going to deal with everything. They're just going to deal with
right.
one piece of the puzzle. And if they did get the benefit of all the different departments they
Mhm.
need, yeah, they'd go out with a garbage bag full of stuff too. Patients, only they're not synergized. They don't work together. You're creating this chemistry set of who knows how much poison. And I want to tell your listeners, and I mean, you probably say this to your patients as well. There is a law of pharmacy that I learned eons ago, and it applies to natural medicine too. But the law says every drug's primary side effect is its primary action. So if you listen to TV, you can see this on commercials. I love listening to these commercials because I'm like, wow, let's I don't want to say a name brand. I don't know if that's inappropriate to name a name brand, but let's just say you have a pharmaceutical that is for sleep.
Hmm.
After they show you this beautiful scene of the person restfully sleeping and everything like that, they tell you the truth is like, this may cause sleeplessness and insomnia and
Yeah.
profound insomnia
And headaches and
and
diarrhea,
all the other things. And
oh,
if it's an
cancer.
antidepressant, what does the commercial do after it finishes showing you little bunny foo-foo jumping
Yep.
through a green,
Mhm.
happy people? They tell you this may create depression, severe depression, and suicidal tendencies, which is the ultimate depression. So I want everyone to understand you need to figure out what your doctor's tools are that they're asking you to take. And they're wanting you to take it forever, generally in mainstream medicine, right? In the
Yeah.
hospitals and everything. They don't say, hey, your heart has this condition, take this medicine
Mhm.
for 3 months, after which time you can get off. Not
Yep.
fixing it, right? So that on a timeline, there is a point, if it was truly even fixing anything, that it's done what it should do and you should get off, even if it's a natural product. It's just like
Right.
it's done what it should do and you should get off. But instead, you go through the correction and out the other side, and that's where it starts manifesting a lot of the same problems that it had. So anti-inflammatories, painkillers, imagine the number one side effects are pain,
Hmm.
inflammation. So the doctor says, well, if you say, hey, I'm having more pain, what does he do? He ups the dosage. And if that doesn't work and you're still in a lot of pain, which you would be, he changes it to a more powerful thing, right? But
Yeah.
it starts the cycle all over again. So when you ask me, it's like, why are we having so much chronic illness? It's because of the whole philosophy.
Mhm.
It is the treatment philosophy of mainstream medicine that despises what you and I do. Because our philosophy from the start is the biggest thing. It's like we're striving for cure.
Mhm.
That dirty four-letter word, cure, we're not even
Yeah.
supposed to use it. And yet, if you look it up in Stedman's medical dictionary, it just means a restoration of health.
Yeah. Yeah. We're
Remission.
really
Everyone's like,
finding that
"Oh, I'm
root
in
cause.
remission." I'm like, remission is a drug term. It's a
Yeah.
medical term. Again, look it up in a medical dictionary. It is a pharmaceutical term for a temporary pause or a reduction of your symptom. But because it's just symptom suppression, it will come back. It's remission is great, I suppose, in at the end of like where you've exhausted everything. Because I can't fix everything. I don't know about you. You know,
No, I can't either. Yeah.
on my phone consults, I try to always remind people as much as I get excited about my technologies, and I was like, oh
Hmm.
my gosh, I see so much opportunity to fix you. I always try to go, please understand. I'm going to tell you what most doctors may not tell you on a phone consultation. I can't fix everything.
Yeah.
For all of my tricks, I can't fix everything. Not tricks, but all my
Yeah.
technologies and all my inventions. Phages too. They are a tool. Antibiotics. I think I wrote a blog one time. It should be on my website somewhere that says antibiotics do not fix neurological disease, or I don't know, something like that. You're using the wrong tool. I mean, it does what
Right.
it does.
Yeah, you're using a hammer to do what a screwdriver needs to do.
Yeah, it's like and yet you can probably tell that you've had patients too that they go, Dr. Jernigan, my throat was so sore. And as soon as I swallowed that antibiotic, I felt better. And I'm like going, how long did it take? Oh, it was immediate. I was like, dude, the gel cap didn't even have time to
Yeah,
dissolve. I mean,
placebo.
and it's not going to repair the tissues that were all raw and all
Hmm.
that kind of stuff. So, I mean, that
Yeah,
ulceration of your throat that's happening, the inflammation, there's no anti-inflammatory effect of these things. So I digress a little bit, but phages
that's okay.
too. I wrote an article that's on the website that's setting healthy expectations for phages because we can see some amazing things happen. Things that in my 30 years, I wish I had all my career to do over again now having this tool. It's
Hmm.
just that much fun. When doctors around the country now are starting to use our inducin formulas, there's 13 of them now, formulas for different broad spectrum illness presentations. I tell them all the same thing. I was like, you are going to have so much fun.
That's
Winning,
exciting.
winning is fun. I was like,
Mhm.
mainstream medicine may never accept this. I don't know. I feel a real huge burden, though, to do my best to follow a very scientific methodology. I've published as much as I can publish at this time by myself. I never took money from the sources that are out there because what do? They always come, money comes with strings.
Yes, it does.
I don't trust. I don't trust. I mean, if you listen to the round table that RF Secretary Robert F. Kennedy Jr. did
Mhm.
on Lyme disease last week, the first couple of speakers were like pretty legit. I mean, all of them were legit, but I mean, they were like senators and congressmen or something
Mhm.
like that, I think. And then you have RFK Jr. himself, who's legit. And
Yeah,
they were fessing up to the fact that, yes, they were suppressing anything to do with Lyme.
yeah,
Our highest levels of marbled halls and pillars and of medicine were doing everything the way I thought they were. They were suppressing me. I was like, how can you ignore the best formulas ever? And still, I think Borrelogen and now induced native phage therapy are still, I believe, I've never seen it, I could be wrong, the only natural things that have been documented in a medical methodology
mm,
in the natural realm. I mean, all the herbs that we talk about,
mhm.
there's one that was really famous for a while, and it said, we gave so many patients this product and other nutritional supplements. And at the end, X number of them were dramatically better. That's not research.
Right. That's
And
observation.
the trick there was we gave this one thing, and then we gave high dose proteolytic enzymes. We gave high dose this, we gave high dose
Mhm.
that. But at the end of the study, we're going to point back at the thing we're trying to sell you as being what did it.
Which is what we do in all research, pretty much.
Well,
We try
not
to
the good guys,
manipulate
I
it
hope.
to do the way we want, right? In conventional medicine as
Yes,
well.
very
Yeah,
often. Yeah, just in conventional medicine, definitely.
yeah,
And it's kind of scary, isn't it, how many pharmaceuticals are slamming us with because
yeah.
there's a new one on TV every day, and it's just like
Every day,
crazy.
yes.
It's like who comes up with these names? They're just horrible.
Yeah, you can't pronounce them.
I
You don't.
want I want to be a marketing company and come up with some Zimbabwean or something that
Yeah,
actually they go with, and I'm like, I just made $1 million coming up
yeah.
with a.
I'll be glad when that's not on the TV anymore, which
Oh,
sounds
me too.
like
Me
that's a good
too.
thing. Dr. Jared, again, this was really wonderful. What do you want to leave our listeners with?
Well, everyone's calling for a new treatment.
Yeah.
And I have done everything I can do to get it out there. scientifically in peer review, so that if you want to look up my name, I published in open access journals so that you didn't have to buy the articles. Like PubMed, you have to be a member. If you want to
Yeah.
look at a lot of the research, you have to buy the articles. I've done everything open access so that people had access to the information. I honestly created induced native phage therapy to fix my own wife. I mean,
Mhm.
I used to think I could actually fix almost anything. It
Mhm.
gave me enough time, and I could not fix her. The first 10 years she was bedridden.
Wow.
People go, "Oh, it's easy for you, Dr. Jernigan. You're a doctor."
Oh, yeah, right. Yeah.
Oh my gosh, how many tears have been shed and how much heartache and how much of this and that. I mean, 90% of our marriage, she was in bed, missing Christmas, all the horror stories you hear in the Lyme world, that was her. And
Mhm.
I could not get her completely well. She's a very discerning woman. I say that in all my podcasts because it's just
Mhm.
amazing. It's like every husband, I think, should want a wife that's always right.
Right.
You
Yeah.
know, not that you surrender your own opinion, but it's like
Mhm.
it was literally, I don't know what, 6 months before the ILADS conference in Boston in 2029 in 2019 that she said, "Are you going to the ILADS conference this year?" And I'm like, "Nah, I've been going for like 15, 20 years,
Mhm.
however long it's been going on." And I was like, "Nah, I'm not going to go to this one." And 3 days before the conference, she says, "I think you should go." And I go, "Okay."
Mhm.
So like I say, she's generally right. And that I bought a Scientific American magazine at the newsstand in the Nashville airport. Started reading a story about phages in that edition of the Scientific American, and it was a good article, but it wasn't super meaty. They don't
Mhm.
get very deep on those, but I just was stimulated. Something about being at elevation,
Yeah.
your own mountains. I don't know. I get all inspired. And I wrote in the margins and highlighted this and that until it was like ultimately, I spent the entire conference hammering this out and it worked. And it's been working. It's
Wow.
just amazing. We're over 200 different infections that we've clinically or laboratory wise documented. There's a new test from IGeneX called the CEPCR Lyme panel. It's
Mhm.
where they culture 64 different types of infections. And I believe right now the latest count is something like 10 for 10 were completely negative in
Wow.
these chronically infected people. And so that hadn't been published anywhere. So in my published article, remember I was talking about the 20 out of the 26
Mhm.
were tested as negative for the infection. That doesn't mean they're cured. Okay. Remember, they're chronically
Yeah.
damaged. It's how we need to look at it. You're
Mhm.
chronically damaged. You're not just
Right.
chronically infected. And but with 30-day treatment, 24 out of the 26 were tested as negative.
That's amazing.
So 92% of the people were negative. Okay. The chances of that happening, when you run it through statistical analysis, the chances, when you compare the results to the sensitivity percentages, the 100% specificity and
Mhm.
92% sensitivity of the lab test, it's a 4.5 nonillion to 1 chance that it was a fluke.
Hmm.
Isn't that amazing?
That's
Nonillion. I'm not
amazing.
even sure how many zeros that is, but it's a lot.
That is awesome.
Like if I just said, well, it's a 1 in a million chance it was a fluke.
Mhm.
Okay. So lab tests don't lie. You're not done necessarily just because you got rid of the infections. Now that formula for Lyme has grown to be 90 plus microbes targeted in the one formula. So we figured out we can actually target individually, but collectively, almost like an antibiotic that's laser guided to only go after the bad guys that we targeted. So all the Borrelia types are targeted, all the Babesias, all
Mhm.
the Bartonellas, the Anaplasmoses, you name it, Mycoplasma types are all
Mhm.
targeted in that one formula because I said, took my collective 30 years of experience and 15,000 patients
Mhm.
that I would typically see as co-infections and put them into that one formula. So when we get these tests coming back that are testing for 64, it's because of that. So there's a lot of coolnesses that I could actually keep going and going
That's
because I
exciting.
love this topic, but I thank you for letting me come on.
Thank you for joining us. How can people find you?
Two ways. There's the Phage Corp company that is now manufacturing my formulas. That is PHAGENCORP.com. Practitioners can go there, and there's a practitioner side of the website that's very beefy with science and all the formulas that were used, what's inside of all the formulas, meaning what microbes are targeted by each one. Like there's a GI formula, there's a UTI formula, there's a SIRS formula, there's a Lyme formula, there's a central nervous system type infection formula, and we can keep going. SIBO, SIFO formula, mold formula. I mean, we've discovered so many things that I could just keep going for hours and
Yeah.
about the discoveries from where it started in its humble beginnings to now. So there's another way if you wanted to see our clinic website is Biologics with an X. So BIOLOGIX Center, CENTER.com. And if somebody thinks they want to be a patient and experience this at our clinic, typically we don't take just easy stuff. All we see is chronic cases from all over the world. Something like 96% of our patients come from other states and countries, and typically have been close to 90% for my whole career. About 30 something percent come from other countries in that. So we've gotten really good and learned a lot in having to deal with what nobody else knows what to do with. But if you do want to do that, you can contact us. And if you don't get the answers from my patient care staff, then I do free consultations with the people that are thinking about whether we can help them or not.
Well, that's excellent. For those of you who are driving or don't have any way of writing things down, don't worry about it. We've got you. We will have all of his contact information in our show notes, so you will be able to reach out to him. Thank you again for joining me. This has been an amazing conversation.
Thank you. I appreciate you having me on. It was a lot of fun.
Welcome to Let's Talk Wellness Now, where we bring expert insights directly to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult with a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcast. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised.